Hello. There's a trend within the pharmacy industry in relation to opioid addiction. As a pharmacy technician, I have processed prescriptions and filled many opioid prescriptions for both temporary pain, such as dental procedures, as well as chronic pain for major surgeries. Many of our patients have become dependent on opioids as a way to cope with their pain and their feelings from anxiety, depression, or other chronic pain. However, it has become an increasing issue and has led to addiction, overdosing, and dependency on opioids, which could ultimately lead to death. Many patients feel the need to fill their prescriptions early. However, this is not allowed. No narcotic is allowed to be filled early. Another issue with opioids is that patients fill their opioid prescriptions at other pharmacies and do not stay at one consistent pharmacy. This shows that they are trying to take advantage of the pharmacy industry and the system by filling their narcotics as much as possible. This is where overdosing and addiction can occur if pharmacies do not follow the same rules. Patients can end up with too much opioids, which can lead to addiction and ultimately overdosing and death. Some patients feel the need to take more than what is prescribed by the doctor and may run out early. This is not allowed, and doctors and pharmacists catch this, and this also arises with suspicion that they may be overdosing or they may be addicted or too dependent on these opioids by consistently taking their medications not as directed by the doctor. I read an article in the Conversation where it discussed how a new drug, CBD or cannabis oil, has come out that could have combating effects to opioid addiction. It has been proven that CBD can help with epilepsy, and now researchers have looked at how it can help patients with chronic pain in their addiction to opioids. And tests have been done on mice and rats as well as humans, and shows that CBD can suppress the opioid craving that patients have, as well as their symptoms of anxiety. A way that pharmacists can help combat opioid dependence and addiction that could ultimately lead to death is by contacting patients' prescribers and having the doctor prescribe a medication called Narcan, which is a nasal spray that any adult or child can give to a patient when they're lying down, and you just spray the nasal spray into the patient's nostril, which can have the adverse effects of opioid overdose, and they can do it as needed. And pharmacists can dispense Narcan to patients after the doctor's approval. In the article, it also stated that the CDC, or the Center for Disease Control, said that more than over 130 Americans die every day from opioids overdose or any sort of pain reliever from the drug class of codons like hydrocodone or oxycodone. In the article, it states that the U.S. Department of Health and Human Services has come up with a 5-point strategy to combat this opioid crisis. And the 5 things are: better addiction prevention, treatment, and recovery services, better data, better pain management, better targeting of overdose reversing drugs such as CBD or this new Narcan nasal spray, and better research. The FDA is also working to combat opioids by decreasing the exposure to opioids and preventing new addictions from arising. They also want to assess the benefits of patients taking opioids versus the risk. And it is our job as pharmacists, pharmacy technicians, and other medical professions to combat and control these types of drugs that patients are taking that are prone to abuse and addiction. As people in the medical profession, we need to control opioid addiction by prescribing lower doses, looking at other alternatives like CBD or cannabis oil, and making life-saving medicines like Narcan that are more readily available for patients.